Well, if you've been hearing a lot about sleep apnea, there's a good reason for it. Our next guest says the medical world has recently learned the disorder increases a person's risk of sudden cardiac death by, get this, 50%. Dr. Patel is here to tell us a lot more about sleep apnea. Welcome to Sonoran Living Live.
Thank you. Thank you for having me.
You know what? It is a word that's tossed around a lot, and I think that a lot of people don't really understand just how dangerous sleep apnea is.
No, it's very true. Sleep apnea, we've known the disorder has existed for several years, but the true nature of the negative consequences of it really have been coming out in the last several years, especially this year alone. There was a big study that was published by the American College of Cardiology that showed that, just like you had mentioned earlier, that untreated sleep apnea is a significant independent risk factor for sudden cardiac death. Wow.
It's frightening, actually.
It is.
It's really, really scary. Now, you focus on sleep medicine.
Exactly.
And what does that mean? So
sleep medicine is actually it's a relatively new subspecialty of medicine, similar to going to a cardiologist or to an endocrinologist. So what I do is I trained in internal medicine originally, and then I went and did special training for a year in sleep medicine. So sleep medicine is a field where we manage all sleep disorders, about 85 different sleep disorders. Sleep apnea happens to be the most common sleep disorder, but I deal with insomnia, restless leg syndrome, narcolepsy, sleepwalking, all sorts of various other sleep disorders, both in children and in adults.
Wow, I didn't realize there were so many sleep disorders. My goodness.
Yeah, many reasons not to sleep well.
Yeah, well, I've got a lot of them myself. But so focusing on sleep apnea, though, there are treatments available.
There are.
So let's talk about some of the options that you prefer.
Okay. Well, in terms of the treatment options, there's really three main treatment options. The gold standard therapy for sleep apnea, since it was developed in 1981, is CPAP, which stands for continuous positive airway pressure.
And that's pretty much what we have right here as an example of. You said there's several different types of CPAPs.
Well, there's one type of CPAP, but there's several different types of masks. So the machine, this is an example of a machine, and it's just providing positive air pressure, but these are just two examples of various different masks that are available, about 50 to 60 different masks available.
Wow, and that's one that, because of comfort level, or what would be the differences?
A lot of it is just patient preference, whatever feels comfortable to you. So
I see.
It does have some impact in therapy, but the biggest thing is just what's comfortable to the patient.
How do you determine if somebody needs a CPAP?
Well, in terms of in determining it based upon the sleep study itself. Well, how severe is the sleep apnea? CPAP is indicated for all levels of sleep apnea, whether it's mild, moderate, or severe.
I see.
There are alternatives to treating mild to moderate sleep apnea. One that's very commonly known now is the oral appliance, or a dental device that dentists are making, which is, here's an example of one right there.
Right.
And those are indicated in individuals that have mild to moderate sleep apnea. The only thing is that they're not 100% effective, unfortunately, in any level of sleep apnea. For severe sleep apnea, medically we recommend CPAP therapy. So
you can't do one or the other, you can't do both. You need to pick one or the other, but in severe cases, you're saying CPAP is the best way to go.
Absolutely.
You know what I'm wondering? We talk always about men who have sleep apnea.
Right.
Do women have sleep apnea?
They do. They do. I'd say probably about 40% of my patients with sleep apnea are female.
Really?
Yeah.
Because we don't snore,
And you don't have to. Actually, it's funny you mentioned that. I actually had a woman in her mid-40s spend the night at my sleep center about 2 weeks ago, and on her sleep study, she did not snore at all, but she stops breathing nearly 20 times an hour.
Oh my gosh.
So places are at moderately severe sleep apnea.
So stopping breathing and snoring are just a part of the symptoms. You can have one or the other and it still be sleep apnea.
Exactly. Well, in terms of snoring itself is a big indicator to us in sleep medicine that there's crowding of the back of the throat, which is where sleep apnea occurs, which is generally straight back here. The bulk of snoring occurs back here, not really the nose.
Right.
Nearly 3 out of 4 people that snore to any level have sleep apnea to some degree, and that's how prevalent it is.
Wow. Oh my gosh, really amazing stuff. And Susan, I know you're standing off to the side, but if you guys wouldn't mind getting a shot of Dr. Patel's socks. I'm telling you, you said you love socks.
I do love socks.
Wow. And his patients buy him socks. That's how much he's known for his cool socks.
Well, I have to say, when I came in, I noticed them right away when he walked in, so I think that's pretty cool.
Oh,
I love them. I love them. But you're right, Terry. We don't snore, we ladies.
I know, we don't snore. All right, well, let me give you some information on the Insomnia and Sleep Institute of Arizona. It's 8330 East Hartford Drive is their address, Suite 100 in Scottsdale. If you need more information, you're concerned that you might have sleep apnea, call them, 480-745-3547, or you can visit their website, sleeplessinarizona.com, and bring them a pair of socks when you go to see them.
Great idea.